is Stacy, and I'm the director of the Advocacy program here at the Storck Center. With me today, I have Mary, who's one of our advocacy specialists. We also have a third advocate. Her name is Fabiola Torres Chalaper, and she was unable to be with us today. But the three of us together comprise of this department, and we're here to assist you with navigating how to access services for your child. So let's start off with the definition of what a parent advocate is.
So the definition of a parent advocate is the ability to understand and effectively communicate one's needs to other individuals. The whole point of a parent advocacy is to ensure that you are getting the training needed for IEP meetings, you are educated in the school system and understand what's going on with your child in the school and any additional resources outside of the school, as well as empowerment. Because of course the whole point of advocacy is learning how to advocate for your child.
So in today's society, unfortunately, there is a lot going on, and there's a lot of competitors for funding and resources at the current moment. So with all of the things going on in schools can be scary for any child and any family, no less a child with special needs. In that regards, it's nice to have somebody on your side who's a team member. So think about some of the things that have been happening in schools today. There's been school shootings across the nation. There's been kids who are lost in the system and eventually drop out of high school and never are able to finish. Or even if they finish, then they flounder and they come out without necessarily having the skills that they need to be functioning independent adults. Now you add on other things on top of that. Families of kids with autism, families of kids with Down syndrome, families of kids with intellectual disabilities, ADHD, health and medical needs. A lot of times children need accommodations in order to be able to be successful in school, and families don't often know where to begin, and that's where we come in. So Fabiola, myself, and Mary have many, many years of experience. Fabiola is also the mom of a child with special needs. And so with our combined experiences as teachers, behavior therapists, parents, school administrators, we are able to help you navigate the systems you need, not just at school, but also in the community. A lot of times people keep on hearing things out there like, what is this ABA? And then sometimes people know about ABA, but is it good? Is it bad? As an example. And then how do I even gain access to services? Well, ABA is Applied Behavior Analysis Therapy. It is one of those things that may or may not be appropriate for your child with special needs. We can help you understand that process, and we can help you gain access to services. So some of the things that we do are help you fill out forms. Do you ever look at a form and just think this is so overwhelming?
I know I have.
Complete this? Yes, exactly. So we sit down with you and we break down the forms and we let you know, okay, and then sometimes too, you go to turn it in and it's, oh gosh, you're missing this, you're missing this, you're missing that. So we go through the checklist with you in order to get services. Some of the other therapies that you might be interested in getting are occupational therapy, speech and language therapy, physical therapy. How about counseling for yourself? Counseling for your child. There are so many services out there. There's respite care. I'm throwing out all of these terms. Some of you may be familiar with them, some of you may not be familiar with them, and that's again where we can come in and help. So we sit down, and the first thing that we do is do an intake session. We're going to give you our contact information at the end of this program. And as part of that, what you would do is call up and we make sure that you meet the qualifications. Mary, what do the families need to be eligible for services?
Oh, great question. So in order to be eligible for our services, you would need to ensure you are a Broward County resident, that you have a child with a disability or a delay between the ages of 3 and 22 years old, and you also have to meet the income requirements.
So one of the nice things about our services are that they are offered for free. We were gracious enough to earn a grant from Broward County, the Community Partnerships Division, to be able to provide these services to families free of charge as long as you meet the income requirements. You may be saying, oh, I probably don't. You'd be surprised, and it's definitely worth a call to help us figure it out. If you don't meet the requirements, there are self-pay options, and we also refer out. There's many other great organizations and individuals in the community who do advocacy, and one of our jobs is not necessarily to have you come only to us, but it is also just to have you get the appropriate help that you need. So we do the intake assessment to determine that you meet the criteria. You don't have to be receiving any other services through the Storck Center in order to qualify for our services. Although we do have a lot of services you may benefit from, and we'd be happy to share exactly what those are with you, along with giving you other options in the community. If you don't live close to here, you need services close to home, don't worry. We are going to help ensure we help you get what's best for you. So if we determine that you meet the criteria, then we're going to sit down and do a needs assessment. We're going to determine what is it that you need. Because a lot of times, as the parents of kids with disabilities, you need to make sure that you are taken care of first in order to be able to help your child. If your needs aren't being met, how do you possibly have anything extra to give? So we sit down and we make sure that not only the needs of your child are met, but your needs are met and the needs of your whole family. So it is something that we look at the full picture in order to be able to help you through the advocacy program. We can talk about things like your own mental health. We can talk about, you need a break. That's where respite care often comes in. And if you give us a call, we'd be happy to talk more about that program. We can talk about if, you're having time to go out, you're getting enough sleep at night. What kinds of things can we do to help you in that situation? And some of that might be that, getting your child additional services. So then we can also help you get those services. And we don't just help you gain access to school services. That happens to be one of our specialties as having a background in education. But we also, I also have experience as a therapist, so we're able to help you navigate the insurance system, getting insurance if you don't have any, getting access to therapies of all different kinds. We've helped families fill out applications for Medicaid and Med Waiver, making sure that you're on that list. And we've also helped parents pick out, get access to transportation, anything that you may need to help you assist your child and your family at doing better, because oftentimes you need additional supports compared to other families in order to be able to get through your day. So with that being said, those are some of the things that we're here for, but we aren't just going to do it for you, we're going to do it with you, because you are your child's #1 advocate. We're just here to assist you at gaining those skills and understanding what you need to do, and to teach you and to help you point things out. But we want you to be a part of the process, because at some point we may not be here anymore and able to assist, but you are going to be with your child for the lifetime.
And for the time being, when we are advocating with you and your family, we do actually kind of become part of the family. We get to know you, your family, your child, because we really want to be able to express your child's needs and everything that they deserve within the community. So I always, like I say, I always become part of the family when I, advocate for families and assist them with therapies and assist them with any additional needs, finding therapy for families, family empowerment, respite care, everything. I'm always here available, we always all are available for our families.
So some of the things that we can do for you, in addition to helping you access those resources, are be on your team. Sometimes you might feel bullied by the school as a parent. Sometimes you might feel like nobody understands your child's needs. Nobody understands what you're asking for. And so part of that definition of advocacy is being able to communicate your needs to somebody else. We can be there by your side to make sure that even when you are having a difficult time consuming all of the information, we are there as a neutral party to be able to assist. So we can attend IEP meetings with you. We can attend 504 meetings with you. We can help you understand the difference between a 504 plan and an IEP. We can also make sure that the types of services that your child may need are documented on that IEP. If your child's having behavioral concerns, we can make sure that there is an effective plan in place so that your child is not just getting sent home every day and having those behaviors reinforced in the school environment by being sent home, and that there is a plan in place to deal with those behaviors so that your child can be a more effective learner in the school environment. So these are all things that we offer and we can assist with, and our unique perspectives from our histories are able to help us do that. We have been working for the past year here at Storck, but many of us have histories outside of Storck as advocates as well. We just have the newer program here, and it's a great thing that the county recognized how many families within Broward County and our community need assistance, and how many families were feeling like they needed somebody on their side, somebody to empower them to be able to help their children. And I think it's a wonderful thing that Broward County had decided to start this program, because this is not something that is offered through the county funding in other counties even surrounding us. So we are very blessed here in Broward to be able to say that we can offer these services to families in need and be here for you. So as I mentioned, we are going to have our contact information at the end of the session. All you have to do is give us a call or shoot us an email, whatever's most convenient for you to get started on this process. And we will meet. We also have lots of options. So you may say, oh gosh, there is no possible way that I can get a babysitter and get into that Storck Center to meet with these people. I can't do it. No problem. We can go to you. Now you might be panicking and saying, oh gosh, my house is a disaster. There's no way that I'm letting somebody in my house. Don't worry. We can meet in the community. We can meet at a Starbucks. We can meet at a library. We'll go out to lunch with you. We will do whatever it takes to make sure that you have access. If you say, with this pandemic, and my medically fragile child at home, I am not ready to meet somebody in person, we do wear masks and take precautions, we can set up a Zoom meeting. We will at some point need some papers signed, but we can set up a Zoom meeting. We are extremely flexible to make sure we have appointment times. We flex our schedules if you need to meet early in the morning, late in the evening, on the weekend. We flex our schedules to be able to make sure that we meet your needs the best way possible. So we are able to help you overcome all those barriers to access that you may be feeling. All of those stressors, we're here to help relieve them. We want you to know that there is help and that there is a lifeline out there for you, and it's our team here at the Storck Center.